Okay.
Hi, everybody. Thanks for joining us. We're going to start right at the top of the hour at 2 p.m. And for those on right now, we'll be getting started in just 2 more minutes at 2 o'clock. Okay, it's 2 o'clock at the top of the hour, so we're going to go ahead and get started. And we've got a lot of folks who are coming in here. So I wanted to welcome everybody to today. We're having a live listening session as part of our 7-part series on integrative approaches to addressing diabetes with the SAMHSA Center of Excellence for Integrative Health Solutions. Next slide. And as usual, I just want to acknowledge that the views, the opinions, the ideas that we discuss and express today are our own, and they do not necessarily reflect any federal entities such as SAMHSA, CMHS, HHS, or others. Next slide. So very, very brief introductions. We have two sort of moderators today. Myself, Andrew Phillip, I'm the Senior Director for Clinical and Population Health at the Primary Care Development Corporation, and also work as an advisor through this with the SAMHSA Center of Excellence. And I'm joined by Bree Ryman. She is the Assistant Vice President for Practice Improvement and Consulting, as well as the executive sponsor of the SAMHSA Center, and she's with the National Council for Behavioral Health in Washington, D.C. Welcome, Bree. And we are also joined, I just wanted to acknowledge a few folks off camera, other members who contribute to the center's work. Sarah Neal will be joining us, Kristen Potterbush, Chaim Shmulewitz, and others from the center as well. So you may hear from them as we go through. So very briefly, I'll intro us and Bree will talk a bit about the center and National Council. If this is your first time joining us, Primary Care Development Corporation, we're a national nonprofit based in New York City, but a national organization. We're started as a community development financial institution, meaning that we invest to help build primary care and other healthcare infrastructure, including behavioral health. We also advocate for improved funding and work to really enhance primary care and behavioral health. And we offer training and consultation, and this is through partially through our partnership with the SAMHSA Center of Excellence. Next slide. So Bree, I invite you to speak a little bit about National Council.
Yes, thank you so much, Andrew. So as Andrew mentioned, I work at the National Council for Behavioral Health as one of the assistant vice presidents for our practice improvement and consulting department. And the National Council for Behavioral Health is a membership association. We have just over 3,300 members across the country who are mostly addictions and mental health providers that serve 10 million adults, children, and families living with mental illness and addictions. So what we provide is training and technical assistance and support to our members on anything from policies and understanding policies and regulations as they impact mental health and treatment services, as well as training and technical assistance on clinical best practices. And the Center of Excellence is one of the initiatives at the National Council for Behavioral Health to provide this type of training and technical assistance and support.
Great, and thank you, Bree. And next slide. So just wanted, this is, as I mentioned, this is part of our effort with the Center of Excellence. And I believe Sarah Neal is on to talk us through some of what the center is doing right now. I'll just get her unmuted here.
Hi, can you hear me okay?
Sure can.
Great. Yeah, so I just wanted to chat a little bit about some of our current work, training and technical assistance work. And on this slide here, you can see this is just a little bit of background about the Center of Excellence, which is through National Council for Behavioral Health, like Bree mentioned. And really the purpose of this Training and Technical Assistance Center is to advance the implementation of high quality evidence-based treatment for individuals with co-occurring physical and mental health conditions, including substance use disorders. So to do that, we provide a lot of different types of training and technical assistance and resources to health providers all across the US and other stakeholders to help address the needs of individuals with co-occurring physical and mental health conditions. So you can go ahead and go to the next slide. I did want to mention a couple of upcoming events through the Center of Excellence. Right now, a lot of our activities are focused on the COVID-19 pandemic. So this upcoming session that you see, both of these on the screen here, are office hours related to COVID-19. One is focused on finance and operations. It is actually today at 3 o'clock. So I will be hopping off in just a little to prepare for that. And then we have another one on Thursday focused on substance use disorder services. Again, these are both COVID-19 office hours, and through both of these sessions and others that are upcoming as well in the next few weeks, these are a really great opportunity to be able to join and just hear from peers who are doing some exciting things in these topic areas related to COVID-19 and really learn from each other and figure out best ways to kind of respond to the pandemic. And again, these are just two of our topic areas that we're focusing on, and some others that we are focusing on as well. One is self-care and stress management. We actually had our first session on that topic last Thursday, and I can share the recording with you if you're interested. And we also have it listed on our website there at the bottom of the screen. And then we also will have some sessions upcoming related to residential treatment facilities and also telehealth. So keep an eye out for upcoming announcements about those sessions. And again, all this information is going to be housed on the website, on our National Council website, which is listed right there on the bottom of the screen. But again, if you have any questions at all and would like more information about this, please feel free to reach out to us. I'm sure Andrew will be able to share my email after the call today.
Great, thanks, Sarah. And Jaime, you can take us to our next slide here. So as I mentioned, this is part of a larger series, and chances are if you're attending today, you are a member of that series. And if you're not, we'll give you information to join. But really, this is all part of a discussion that started around diabetes and looking at how both primary care and behavioral health, particularly when they integrate together, can really work towards addressing diabetes, towards improving screening and management with our patients that are at risk or have diabetes, bringing together multi-interdisciplinary teams, taking either those teams, or even if it's just one person, just you, and to really build around that team or that individual or that clinic to enhance processes and procedures and offerings related to diabetes. Next slide. I'll just acknowledge, if you're hearing any background noise, it's because we're right here on the river between New York City and New Jersey, and so there's a lot of activities you might imagine. But I did want to acknowledge, so we're actually a few steps into our diabetes series. We've just finished behavioral treatment and prescribing practices. Coming up soon, we'll have the link at the end here, is sessions focused specifically on nutrition. And you can find recordings of our past episodes at the links below through the SAMHSA Center of Excellence, as well as the Primary Care Development Corporation. Next slide. So, we always start each session off with a poll, and I want to continue that, even though today is a little bit unique. And so tell us who you are, and I think you can select multiples of these if more than one fits you, but do any of these categories represent you, or do you mostly function within primary care, within behavioral health? Are you more of an administrator? Are you involved in policy making? Are you from the managed care world? Are you more of a social service or community-based organization? Are you someone else? And if so, you matter, and we want to know who you are, so feel free to use the chat box to enter in information about you. I also do want to let folks know that we are recording today, although we likely will not post the chat, but again, just so that you know, and we'll also make the slides available to you, as well as the recording shortly after today's presentation. So let's go ahead and see what our slide results here are. We're seeing some folks chatting in there, and I don't know, Jaime, if we can display the poll results. Healthcare, software technology, substance use disorder, RN care manager. And we can head over to the next slide. So we also want to know and acknowledge, and I'll go into this more in a moment, but the realities of what life is like for you where you're watching. As I mentioned, there's some unusual things going on outside here in the city, but we also recognize that life is not as it's been. And I want to know, kind of, where are you dialing in from? Are you in a clinic somewhere? Are you in an office, like in person in the office? Are you working from home, but your work life is sort of otherwise normal? Are you working at home, but you have some additional responsibilities or situations going around you, perhaps caring for children or others, or something else? And again, feel free to use the chat. Let's see if we can post our results here. So so this is very interesting. So we've got about 34% of people are saying that they're calling in right now from the clinic, and thank you to everyone who's out, working with our patients, doing really like the hero's work on the front line. We have a number of folks who are supporting from office settings, a smaller amount though, just about 4%. And the majority of people, 48%, are working from home and otherwise conducting business as usual. Here in New York and New Jersey and many other states, of course, we're now all kind of required to work from home. And we do have about 14% of people who are working from home, but also dealing with these other situations, kind of helping care for others. So thanks, and we can head to the next slide. So I'd like you to, as we go through, if you can use the chat box and also give opportunities to unmute yourselves as we go through, but just type into the chat, what's going on around you? What are you seeing in your clinics? We really want to use today to share out some of what's going on. We've seen a ton of flurry on listservs. We see people asking for information, a lot of sharing of resources. But I kind of want to know, what are you seeing? What are you dealing with? What's happening where you are? So you can use the chat box on the bottom right there to enter in. And Jaime, you can take us to the next slide here. Okay, so again, I want to acknowledge, obviously this is a unique moment, no surprise for our world, but also for healthcare. And it's fundamentally changing the way that we provide care. And I would argue that really now more than ever, we're called in to do more and also to do it differently while still providing that wider range of services. And this is really a call for the enhancement of our robust, highly functioning healthcare system. And I think this especially highlights the need for critical access points and the major access points for healthcare. We know, in addition to obviously right now hospitals, are primary care and behavioral health, where the majority of people tend to get their care. And so it's critical that we continue to invest in that. At PCDC, we're doing a lot of work around that, and certainly National Council is advocating around behavioral health providers. But I also want to acknowledge that this is not a point where we are about to stop the work we're doing around integrated care. Our diabetes series, for example, is continuing. And I think this highlights more than it ever has been before, that whoever you are, whatever type of healthcare provider or support staff that you are, whatever role you're playing, it's more critical now in this moment that you as an individual are able to provide an even wider array of services, provide patients with more options, with more linkages to care than you were before, because every single visit may be that patient's only visit for a longer period of time now. And so, again, I think this topic is critically important. And also, part of why we want to have this listening session today was because, also acknowledging that, for those of us in behavioral health, we know this, but also everyone, we're all kind of in a collective adverse event or potentially trauma right now. And one of the most important things that we can do for ourselves and also for others in our profession is to share our experiences if we're comfortable doing so. And so that's kind of what we're using this forum for. You can take us to the next slide. So as we go through, I just want to first, just before I kind of get into some of what I'm seeing out in the world, and Bree will also talk about what she's seeing, I want to kind of report out some of what people are mentioning that their experiences are right now. And we're getting a lot of feedback here. So let's see. People are definitely saying increased anxiety, fear about COVID-19 in patients, right? And so I think that's probably for us as from the healthcare provider stance, but also everyone that we're seeing, and our patients are afraid. Other people mentioning anxiety, learning how to use new skills, and I think this is particularly highlighting telehealth. Let's see what else we've got here. Anxiety, folks are mentioning suicide attempts. I'll comment on that in a moment. People are saying it's been quiet and very few face-to-face patients, definitely some anxiety. Some folks are mentioning feeling more siloed and less integrated, actually, which makes sense and is concerning, but people being stressed, scared, physician burnout prominent. All right, so I'm going to come back to these. Please keep entering these in here. And so, certainly what we've been seeing here through our national work and our work in New York and in the tri-state area, I'm concerned about what was already an epidemic of loneliness and isolation within our country. Obviously, this is increasing. We're seeing potential for increased events of violence within the home, as folks are in the room are mentioning, there's sort of debates about whether suicide rates are sort of spiking at this moment or sort of not, but either way, they weren't going in the right direction before, and certainly I don't think that this is going to help that. We're also, I believe we're going to be seeing exacerbations around existing conditions, things like chronic pain, substance use disorders, and also medication adherence, and not just medication adherence from a patient's not following orders kind of idea, but people being concerned about visiting the pharmacy to fill their medications. Maybe they're putting off their care visits that they would normally use to fill medications or get refills, right? And within the context of diabetes, this is particularly concerning. Also, just access to the regular in-person services. And we're not only talking about primary care and behavioral health, but even thinking about pain, we're thinking about things like PT, physical therapy, occupational therapy, right? Things we know that keep people functional and moving, visits with their pharmacists, visits with other members of the care team, their social workers and others. As we see people putting off those kinds of visits in the context of COVID, the trajectory for these healthcare concerns and things that may be preventative that we could catch early, I think are very concerning. And of course, and what we'll hear from people talking about today, operational concerns are plenty. We've heard about difficulties accessing protective equipment, concerns about financing and reimbursement practices. Bree, other things that you've been seeing that you're hearing about from constituents at National Council and in your national work?
No, I just echo what everybody is saying here. I think also we're learning just of all the different policies and revisions to policies that are coming down the pike. And I think somebody in the chat box mentioned just keeping up with all of that and how much of a challenge that has been. So some of what we have been offering at the National Council and that we will have a recording to is these town hall series where we're trying to provide some clarity around things like the Small Business Administration and what they're offering to employers who are having to change the way, quite frankly, the way that they do business, and hearing about the telehealth policies that are changing, and really thinking both about how that impacts us today, but also what is healthcare going to look like 4 or 5 months from now? And I've heard providers say, we can't quite possibly go back to the way we were doing business before these policy revisions. So I've been thinking a lot about, picking that up in terms of supporting providers and employers in terms of how the workforce is going to change. And also, I was on a call earlier today, Andrew, that I heard about this with the American Psychiatric Association about really preparing employers for the loss of workforce related to COVID because of all of these issues that you all mentioned. And how do we use resources like the employee assistance programs and benefits that are already in place to take care of the healthcare providers that we're working with? So I think just thinking about, what we're doing and what resources we're able to provide to keep the workforce engaged and also to just support them through this troubled time.
Yeah, I think that's similar to across the board what folks are doing, and we'll share the resources for National Council as well. I'm continuing to look at the chat here, and it's interesting seeing folks who are mentioning that we've had a couple of people comment that their whole clinical team is there in the clinic providing direct services. Some of the support staff have gone home. Other participants are saying that they've transitioned completely to telehealth, or at least for the majority of visits, but also just that there's been a decrease in visits overall. I'd love to, we can't unmute everyone's lines because we have just a great number of participants today, but it'd be great to hear from some folks. And so if you'd like to, speak out and kind of particularly to share what you're seeing, what you've been doing in your clinic, you can raise your hand using the function within probably your bottom bar there in the Zoom platform, and we'll unmute your line to hear from you. But we'd love to hear just even verbally, and I'll keep reading through the chat, but if you've had, if you don't mind sharing your experience with us. And I'll ask Chaim to let me know if we have folks raising their hands. And as you do that, Chaim, we can go to the next slide and actually pull up a poll on this telehealth issue, and we can continue through this. Go into one more slide over. So curious, again, I'm seeing a lot of people in the chat, acknowledging the transition to telehealth, concerns about that. So we can just get a quick number here. So let us know, are you offering services right now by telehealth? no, so maybe your organization can't support it, or you haven't figured out the payment situation yet, still doing only in-person visits. Have you had to close your clinic? And that's something that we've been seeing, unfortunately, particularly around small practices in New York, but also elsewhere, is folks just having to shutter their doors because they don't have the infrastructure, or they were already, just frankly on the fiscal edge. Are you doing telehealth and it's going pretty well? Are you doing telehealth and it's just been a rough go? So let's check out the results here. And let's see, Chaim, are you able to share those with on the screen here? As we're waiting for that, I'm just seeing other things. All right, here's our results. So as far as telehealth goes, you're saying, so very few people, only 5% are currently only offering in-person visits. A little bit more, 10% of you are saying that you're really limiting operations and you're not offering telehealth visits. And that's still 10%. The vast majority of people, 64% of you, are saying, yes, you're offering telehealth and it's going pretty well. And then about 20% are saying yes, and it's been pretty rough. That's pretty encouraging to see that so many people are offering telehealth and it's going pretty well. And on that note, for those of you that are offering telehealth, again, I encourage folks to raise their hand if they'd like to just verbally share out in terms of what you're doing. And let me know if we have any hand raises yet. Not seeing those yet. So I'm going to keep going through and seeing what people are doing. So we've got Julia saying providers are working on a mix of remote and in the clinic. Staff are scattered, and the flow of handoffs between medical providers and behavioral health providers is disjointed. Drop-in referrals to behavioral health. We've got folks who are reporting their first COVID confirmed clinicians within behavioral health. Jenny's saying, struggling to keep up with constantly changing processes and directives from corporate or managers, even higher productivity expectations despite adjusting to health service delivery. That's pretty interesting. Greater need for clear communication and providing support to staff on the ground. We are seeing some increased social support services, things like meals and utilities, bill deferments. That's from someone in Philly, so that they're able to help refer patients to social work services. That's great to hear. Bree, anything that you're seeing in here that you want to comment on that's really sticking out to you?
I did notice a comment, and of course I can't find it in the shuffle, about rural communities and how rural communities are, what strategies are being implemented in rural communities. And I just wonder if there are others on the call today that are from a rural or frontier community that are possibly having challenges with telehealth or finding other ways to connect. And then I'm also curious about addiction services and, and how, how providers on the line are keeping people engaged in services that might struggle with substance use disorders, and also people in recovery, because we know that things like AA groups are all virtual now as well. So how are these resources being communicated to the patient population?
I'm seeing like a little bit more on the phone visits here, and yeah, I think I'm curious to see what folks are writing in starting now around substance use disorders, because obviously that we don't expect that's going to get better in this moment. Julie mentioning we've moved all behavioral health visits to phone calls with surprisingly positive results. We're also providing robust outreach to vulnerable populations like elderly, isolated, people with elevated PHQ-9 scores recently, people who are recently seen in the emergency department for behavioral health reasons, or step down from inpatient psychiatry. And I think that's we've seen a lot around inpatient psychiatry, I think, and some of the concerns about, do we change things through non-ambulatory care? Do we still keep providing care as normal, things like that? So it's good to see that there's some considerations there. Another comment on telehealth. The company I work for focuses on telehealth services, and I'm one of the few who works on site for our clients. Overall, the transition has been pretty seamless because we're already set up for this. But I think this is a really interesting point, the participants of the programs, particularly those on site, aren't used to this method of communication, and we're seeing a lot of non-compliance or difficulty with that. And so that's, you know, I think that's an important point too, right? As from the kind of provider angle, we're all sort of trying to navigate telehealth, but also our you know, our clients and our patients are doing this as well. So we've got an entire behavioral health department doing virtual visits, going well. Some are saying it's a challenge, especially for some of the physicians, less so like the behavioral health consultant or the embedded behavioral health provider within the integrated care team. Joyce sharing that in our clinic, we were given guidance to cancel appointments. We made an immediate decision to call and give the patient the option to keep the visit by phone. The first 2 weeks it went well. This week, you know, as the pandemic continues, we're finding patients are canceling these appointments. And she noted things like increased stress and difficulty focusing that they're saying. Okay, and we've got some questions coming in. You know, folks who are tuning in related to diabetes, of course. This is part of our diabetes series, but we're doing kind of a one-off listening session to find out what people are doing here and what's on everyone's minds. And we can head over to the next poll actually while people continue to chime in here. So curious your individual experiences. So what are your immediate concerns right now as a person in this world, as someone who's experiencing this as well? You know, are you concerned about your health, you know, your family's health? Is it access to protective equipment, masks, gloves? Are you concerned about your employment? Are you concerned about finances? Are you worried about the social impact of this? Other things. And again, use the chat to share these in here and we're going to highlight your responses. We can check out the results here. And there we go. Okay. So vast majority of people are reporting, 73% of you are saying, you know, access to, for you and your family, your health. Fortunately, a smaller number, 12% of you are saying access to PPE, which hopefully means that either, you know, you're working from home or there's sufficient supplies in your clinic, but chat into the text to let us know. You know, obviously employment is, I think, a concern for folks, and we're seeing 44% of you indicating that. Finances, fortunately, less, so 24%. 63% of you are acknowledging some of the social or societal impact. And I'm seeing also folks chime in more here. I'm most concerned about the economic impact with which this will affect depression, suicidal ideation, anxiety, et cetera, more so than the physical health of the virus. And so that's interesting too. And I think acknowledging that there's kind of the immediate thing that's going on, but also even like the not too distant future. And again, I encourage folks, if anyone wants to chime in to our kind of verbal conversation, all you have to do is raise your hand and we'll go ahead and unmute your line here. Allison saying, concerned that should one of my family members in another state become ill, I won't be able to be with them during this time of illness. And I think that's, gosh, that's great. It's already difficult enough providing care, but then thinking about our own concerns, right? Our ability to be with our own family members, our parents, our children, people in other states, people that may be particularly vulnerable and that we don't want to visit because of concern about potential spread.
Andrew, we're going to have a share from Jenny. Jenny, you're unmuted.
Great, thank you. Yeah, I figured it was worth chiming in at this point. You know, I think one of the major concerns and adjustments I've had, you know, in addition to just work demands and adjusting to the telehealth and remote working, is that we are in a position where as caregivers we're expected to reach out and take care of everybody in this time, and almost expected to have more answers than are actually out there. And you know, so I'm just really grateful to have this session today, because it's seeing that it's not just limited here, that these are the concerns that a lot of us are facing. So yeah, I think just the concern that we still have personal lives too. We still have all those concerns about our real lives and our family members, and needing the extra support to take care of ourselves so that we can continue taking care of our patient population. And I feel like, in certain moments that may get overlooked, you know, that we're seen as heroes. And it's like, okay, but we're not superheroes, we're still human. So that's sort of where I've been feeling the extra pressure and the extra stress, is trying to make sure that I'm well nourished and well fueled so that I can hold everybody else's emotional concerns at the same time.
Gosh, thanks, Jenny, for speaking up and sharing that. I think that's, you know, it's funny. I hadn't thought about that until you just mentioned this, but that sort of label of heroes and thanking everyone. I did that earlier, but that does sort of imply that there's this superhuman element, and that, you know, folks who are providing the care aren't without their own need or don't have these other concerns. You know, you know, when I was in the clinic, I always felt this too. Anytime anything in my personal life was going poorly or was stressful, it like turned up the volume on how stressful the actual work was, and kind of you have to transition between, right, your personal experience and your sort of professional caregiver experience when we're working with patients, and that itself is exhausting.
Right. And it can be more difficult to do when you're working from home, you know, to have that boundary between personal and professional.
Absolutely. Others who want to chime in, others who wouldn't mind sharing your experiences. While we're waiting on that, Ham, can you take us to the next slide here? We have another poll that I think could be interesting. So kind of flipping to, what are you doing? Like, what are you finding most helpful right now? You know, are you doing things like deep breathing, relaxation, or meditative practices? You know, are you getting, and you can choose multiples of these if you're doing a lot of them or finding more than one helpful, but, you know, are you connecting more? Are you getting support from friends, from coworkers? Maybe you're using video to connect with folks like we are doing right now. Are you really focused on keeping that routine, keeping everything kind of set so it feels a bit more normal and doable? Are you finding new hobbies, doing things that are relaxing like that? Are you one of the people who are kind of getting out for a little bit and doing some distanced running, at least 6 feet from everyone else, or exercising in your home? Are you doing something else? And again, use the chat to share that. And if you have a practice that you'd like to share with us, just raise your hand and we're happy to have you join us. So we'll take a look at the results here. And as we're getting it, oh, I see one that gosh, this is just, I'm so glad that that one of you mentioned this, and that's keeping appointments with my own therapist is something that's been keeping us going. You know, we've seen chat about people utilizing their own kind of professional resources that are available through their companies, but also this is a great time to rely on your mentors, your consulting clinicians, and yeah, your therapists, right? I think that's, it's amazing that, you know, just like you said, you know, Jane, we're human, and I think sometimes we don't acknowledge that we also need these human things. Spending more quality time with my dog, practicing gratitude, spiritual connection with friends. Yeah, and other folks mentioning their own therapists. I'm so glad to see this. Catching up with work and other enjoyment activities has really been, that are normally postponed because life is so busy. I haven't seen the results yet. I just saw that question come in, so I'm not sure if we can share them here. Okay, seeing the results coming in through creative mechanisms. Okay, so the latest results here are, gosh, people, so the majority of people are, well, it's almost a split. So we've got 61% of you are really keeping things going by keeping a routine. We've got 50% of people who are getting live or virtual support from friends or colleagues, and hope they're getting some of that here. 41% of you are saying meditation or deep breathing. And actually the majority of folks, 63%, are kind of finding the most help from doing things like exercising. And then we've got others coming in the chat. Again, feel free to raise your hand if you want to kind of vocalize some of these things. Let's see, find it helpful to limit exposure to media to assist, and assisting patients with that as well. That's a great point from Gina. I think we're all, you know, especially when this was sort of unfolding, and Bree, I don't know if you know, I'm sure this has been coming up with folks at the National Council as well. You know, we were all really glued to, you know, the political Twitter feeds, keeping an eye on, you know, emergency management departments and others. So we knew what decisions to make, and you know, within clinics, we know kind of what the latest is. But sometimes now those kind of linkages have become so overwhelming. Bree, other things, is there any other guidance that National Council has been putting out, or things that you've been doing there internally? Curious, I know that, you have so many members. What other things are you doing?
Yeah, similarly with the volume of information coming out and a lot of questions about what sources to rely upon for information. And of course, we're saying, the CDC and the WHO primarily. There's also this issue of there's, a lot of technical assistance and resources and one-pagers and there, so much that people are already feeling that sort of burden or, exhaustion around like, what do I pay attention to? Who has the best quality source? So I think we're trying to streamline our efforts to fill a need that's not already being addressed by another organization. So, I think we just put out a one-pager on guidance for residential treatment and just tip sheets, things that people can easily access around even things like how do you talk to, kids and adolescents about COVID-19. So easily digestible and consumable information that can just be read very quickly and sort of absorbed and written at all different levels for providers, but also just for people, the populations in general that need this guidance. Because I do worry that there's just so much out there and sometimes it's just a little bit of overload. And I think that's the benefit of this type of format, Andrew, where you're just having people come together just to share and sort of build that community with these poll questions and others.
Yeah, I think definitely that sort of finding what's the right amount of information to share. We're not getting overloaded. And I'm going to ask, actually, we have a poll question that gets to some of that. And again, I'm going to keep giving voices to some of the chat that's coming in related to these things. So we've got, again, limiting media consumption, people using things like virtual church services or religious activities. I think that's another great source of support. More people, again, limiting exposure to the media, spending time with children and trying to support them because they're scared, even though they don't necessarily understand what's going on. I think that's that's another interesting area as far as pediatrics. And I know the center is doing some work there, but parents, I think, are, and including those of us here who are parents, right? So we're trying to work with our patients on answers, but we also have our family who may be asking questions, who may not fully understand. And I think we'll talk about some of that on the next center activity related to pediatric care. But I know that's been a struggle and finding ways to validate those experiences with our own family. Another individual saying maintaining a spiritual routine, limiting your information source. So picking one kind of reliable source, and we'll share some of those with you in a few moments here. All right, so we'll go ahead to the our next slide here, because I think that'll get to some of this. So, as I mentioned, this is part of our diabetes series. We haven't talked a whole lot about diabetes at this moment. I acknowledge that this was sort of a drop-in session, but our next session is coming up on the 20th of April at 2 p.m. And you've got if you're in here, you're probably already registered for that, but just in case. There's also echoes and TA available through the center. And Jaime will take us one slide over. And there are a few key resources. And so I think this gets to that point of sort of picking and choosing where you're getting information from. We've got the National Council who just held a town hall related to some of the financial incentives or sort of safety nets that are coming out right now. And that's going to be available, and you can find that at nationalcouncil.org/COVID. And also through SAMHSA, they have a special COVID dedicated resource, and you've seen some updates come out from them related to things like 42 CFR Part 2 and providing medication-assisted therapy or treatment. CMS also has updated guidance, and I think those are good places for us as providers to go. Bree, anything else that you've been seeing, what are your sort of trusted sources of information right now?
I would say that the American Psychiatric Association is coming out with a lot of information for providers, specifically around populations living with severe mental illness. So I think they have a lot of really good webinars, technical assistance opportunities. They are funded much like we are at the National Council through the Center of Excellence through a grant to offer basically free technical assistance and training. So I think that's another really good resource for information.
Excellent. And Chaim, will you take us 2 slides over now? So PCDC has resources at pcdc.org/resource, but I'm particularly curious, so you've shared some of the things that you're experiencing and doing. Where are you going for your information? Do you have particular resources that you're really finding helpful? I know that there's been, right from the American Psychiatric Association, the American Psychological Association, the American Medical Association, guild-specific resources. I think we've been getting lots and lots of things like tip sheets, communication guides, safety guides, things like that. But I'm curious, those of you who are here, where are you getting information from? And do you have any resources that you have that you're really, that you're finding helpful, or just, other things? And again, feel free to raise your hand to kind of share out verbally, again, telling us what's going on or what you're using, or using the chat box there to enter your responses. We've got folks mentioning the CDC. Of course, we cannot forget the Centers for Disease Control, really as our nation's kind of guiding light as far as what decisions we're making around health, around the latest PPE or protective equipment guidance, and also things like travel advisories, as we've heard about. The World Health Organization, Elizabeth is mentioning, so another one sort of outside of our country here. And I think that also brings up some questions, right? So sometimes we're seeing that there's information that isn't exactly identical that comes from particularly within federal, outside of federal, at the World Health Organization level, and that's complicated as well. Curious what other folks are seeing. And also, in addition to folks who are raising their hand, Kristen or Chaim or Sarah or others, if you have other resources that you're seeing or that you're hearing people talk about, feel free to hop in and mention those things. I'm going to continue to cycle us through some of the responses here. Another person's mentioning, and back on the telehealth issue, rural communities and telehealth, where this can be challenging. And I'm glad, James, thanks for mentioning this. So not saying that not everyone has access to telehealth. And so maybe it has to be a phone conversation. And I think that's that's such a great point. I'm glad that you're saying that, right? And he's elaborating that as a behavioral health provider, I work closely with our medical providers for consultations and, if possible, kind of a quote unquote warm handoff by telehealth, by phone or in person. And so, I think that's the phone, use of our phones is, I think, something that seems so simple that we may be overlooking it at times. But there's good evidence that shows that there's lots of interventions, even assessments that can be conducted by phone. We can offer support by phone. We can offer forms of therapy by phone, even if we can't see the individual. Of course, there's unique considerations doing that, but it's a great point, especially for rural areas where there may be less access to internet. We also know that's a concern, and Bri, I'm kind of curious if your others are seeing this as well, but even here in urban areas, so I'll speak for New York City, there's boroughs of the city where, although, this is a major metro area with frankly, just massive infrastructure, we know that particularly people with lower income also may not necessarily have easy access to internet. Some of the things that we're seeing is subsidized housing offering complimentary internet for their residents to try and get that set up, giving out devices to children. We also know there's a whole parallel process going on here with our education system, right? Again, seeing what other folks are putting in here. Maintaining spiritual routines. Another rural community comment. So, encouraging, so substance use, and Bri, I think this is to your earlier question about substance use disorder. So Amber is saying our substance use disorder providers are offering in-person and telehealth for patients, but also encouraging telehealth, certainly when people are open to it, but acknowledging that each case is individual based on history and recovery. And she's also mentioning this is a rural community where transportation has been an issue, especially with COVID. That's another interesting point, right? So every time we talk about rural healthcare, transportation comes up, right? Really every time we talk about care anywhere. But as we're seeing, even basic things like ride sharing applications getting harder to use or limiting access, I assume that transportation is only becoming even more of an issue for those people who can't engage in care remotely or who don't have the types of issues that may be appropriate for right now.
Yeah, and Andrew, I would say too, just one thing that we have learned from being on multiple calls with SAMHSA and other grantors is that there's a lot of flexibility this doesn't apply to everybody, but for many of you that might have grant funding, in terms of the ability to flex some of that financial support to for things like transportation incentives, or revising the way that you currently operate certain things. So I think certainly asking and having those conversations with the folks that might fund some of your programs is certainly a strategy we're using currently.
Great. And I also saw that you mentioned another good resource for people, the Center for the Study of Traumatic Stress. I'm going to actually paste a link to that for our attendees. This is another one that I've been seeing shared, and again, acknowledging that what we're going through right now, this is, we have a real live ACE that is happening collectively to just about all of us, right? The impact of this, whether we're a provider, whether we're, in the military or civilian, whatever, this will be felt for a long time. And so I think using organizations like the Center for the Study of Traumatic Stress makes a lot of sense right now. And they also provide tip sheets and some language that folks can use with their patients. We're seeing others. Kristen, feel free to chime in if you want to unmute yourself here.
Sure. Good afternoon, everybody. So I just wanted to share that the Health Resource Service Administration has been releasing some pretty important guidance for FQs as far as reimbursements and also sort of parameters therein. So especially for folks who are connected to, affiliated with, in partnership with, or currently at an FQ, if you're not already looking at some of the FQAs or the frequently asked questions that HRSA has been releasing, really encourage you to do that. And then also, if you're providing services or receiving Ryan White funding, HRSA has also been releasing some really important information around not only billing, but sort of workforce considerations right now. So I don't know if anyone on the call provides services to individuals at risk or living with HIV through Ryan White program funding, but would really direct you to HRSA's website for that. And then I guess sort of on the substance use disorder side of the fence, the Harm Reduction Coalition, which you can find just by Googling Harm Reduction Coalition, or I think their website might be harmreductioncoalition.org or something like that, has been actually releasing a number of resources in a couple different languages that are relating to syringe exchange, harm reduction sort of during the time of the present pandemic, and then also around safer drug use during COVID. And I think that that's something that some of the clients, the patient populations we work with, we have to acknowledge that sometimes that does take place. And so I know I saw in the chat a little bit earlier, folks were asking questions around resources or how to provide telehealth, telemedicine in circumstances where, maybe not everybody at your practice, your organization is able to speak the languages that, the clients, the patients that you're bringing services to speak. So just directing folks, to the Harm Reduction Coalition if you need resources that are aligned with the work that they do, that they have, they've been working hard to push out a variety of different translations of their work.
Great, thanks, Kristen. James mentioned something interesting, and James, if you want to chime in, feel free to raise your hand and we'll unmute you. Commenting on some of the advantages of being over 65 and a behavioral health provider. I think there's different ways to go with that, but something that I've been particularly working with some of our our senior folks here at the Primary Care Development Corporation. Where our offices are just on Broadway off Wall Street in the financial district, and we're right by the World Trade Center. And so we have folks here, but also I think this is just a great opportunity to draw on the experience of other members of our care teams, people who've been through other major disasters and epidemics and pandemics. Obviously 9/11 is one that's really palpable, but even things like hurricanes and others, where we've kind of had to navigate through really unprecedented experiences, and I think that's important for leadership, to draw on. So, whether you yourself have been through that and kind of led an organization or a clinic through it, but also maybe there's members of your staff who have been through that themselves. And I think this is a great opportunity to involve, create representative committees within your organization to bring on, to pull on not only new ideas, but also experience and voices of experience that's just so valuable in a moment like this. You know, particularly for those of us who, you know, have not necessarily been in the field for 40 years, you know, it's always important to value those with experience, but especially right now. We're seeing other people kind of comment in here. Kristen's been sharing with us websites for harmreduction.org and also HRSA, which of course is critical for those of you from federally qualified health centers. I'm just kind of pulling up other comments here that folks have been sharing. We're seeing increases in calls to 911 for non-emergency issues, including the county mental health crisis line. Gosh, that's, talk about something that's already burdened. Transitioning patients now receptive. We have, again, folks who are sharing really good results as far as tracking daily appointments through telehealth. Again, virtual visits, guidance to cancel appointments. You know, here, Elizabeth sharing in Palm Springs that although it's not rural, the vast majority, I think this is a really interesting one too, although not rural, the vast majority of patients are 65 or older, and it can be difficult to teach them how to use telehealth. I think there's a lot of variability in terms of kind of health and technology literacy. Sometimes related to age, sometimes it's related to all sorts of other things, early access to technology. And so that's, I think there's a lot of variability, but that's a good point of making sure that, and I think that's a great opportunity again to, if you can, to use just phone-based care, at least to kind of make that transition with people to help them for whatever reason, whether they can access it or they're not familiar with the technology, to kind of help them make that leap and to guide them through in the simplest way possible. Others have also mentioned being creative and patient. Oh my gosh, actually I think is something for us all to really to gain something from, and that's a good example of it. Other folks mentioning connectivity, limited access. Okay, and again, if folks, anyone else wants to, we're gonna wrap up in just a few minutes here, but if anyone else wants to raise their hand, share their experiences, and again, continue typing in the chat box. We do have another poll, and really part of why we're doing this, you know, we're giving, we want to hear and have folks share out what their experiences are, and I thank everyone for doing that. But also, I want to make sure that, you know, what we're offering PCDC, what BRIA and the National Council are offering, and then kind of jointly what we're doing through the Center of Excellence, and for the remainder of our series on diabetes, that it's kind of effective in getting at what you need. So if Jaime can take us to the next slide here. So as we look through to even April and maybe a couple months after that, what are the things that you would find most helpful? And I want to acknowledge that there's probably some variability here, and choose all the ones that apply to you. But you know, I'll say as folks are filling this poll out, and we'll give a few extra moments with this because I know it's a kind of a long poll. There's a lot of questions in here, but with our series on integrated care and diabetes, you know, we had some discussions about that, to the spirit of being creative and sort of being patient and thinking on our feet. And Bree and I talked about it, and Kristen and everyone at the center, and to that spirit that we talked about earlier of, you know, this isn't the moment where the answer is that we should just drop integrated care, right? We want to continue, you know, diabetes isn't going away. And again, there's a moment right now that makes it more important than ever before that behavioral health providers and primary care providers and all the other folks, pharmacists, social workers, dietitians, OT, PT, oral health, dentists, and others, you may be the, again, I know I'm repeating myself, but you may be the only clinical visit that patient has for perhaps a month or more, just being realistic. And so although we can't expect you to kind of depart from your scope, the spirit of the diabetes series was really around increasing capacity for all members of the care team to offer a more robust array of services, or just options at least related to diabetes. And so we're going to be continuing forward with our series as planned, although we'll be talking about, and we started doing this on the last episode earlier this month, but talking about how can we adapt some of these services for telehealth or topically related to COVID. So we are moving forward with this, and I'd encourage everyone, and I know we have lots of folks who are kind of general integrated care stakeholders here, to keep doing the work that you're doing with a frame, but not to feel like you have to abandon all the great things that you've already been working on. And Chaim, if you can, we'll try to bring up the results, or otherwise I'll kind of read them off to folks. But in the meantime, Bree, anything else to that point that, because I know that we've all, and you highlighted other folks who do technical assistance and kind of thought leadership in this area. Anything else that you're thinking about this, or that conversations that you've been involved with?
I think one of my biggest focus areas now, based on the several calls I had today, is just, again, focusing on ways to support the current workforce. So I would be curious, as you're doing this poll, to see, what are some things that we can do for our teams, for ourselves individually, and what does support look like in terms of, yes, we know that there are these resources like an employee assistance program that are wildly underused across the country, so that isn't necessarily the solution. Many of you mentioned having, your own therapist that you're staying connected to, which I think is great. But just what are some other things that we can do to be supportive? Are these types of sessions something that you appreciated? As I saw some people chime in, and I think we heard from Jennifer earlier, who said that she was very appreciative of this type of session, just to share, so that we can, again, use this time to pivot our resources to be supportive of you all.
Great, thanks, Bree. And so we can see the results here on the screen, and so I'm going to read them off for folks. I know not everybody's able to see them, but to what you just, to that point, and I think it's important that everyone has the information right now, right? And that's part of why we're trying to kind of share everything out that we're hearing here. So the largest response was to the question on more topic-specific webinars, things like diabetes, pain, and that's reaffirming, I think, to what we were thinking, and also we may have a little bit of a selection bias in terms of folks we're asking, since we know that most of you, if not all of you, are part of our diabetes series. But that's great, and that's really encouraging to see that 62% of you are saying we got to continue with these things. So we will, and we're going to keep doing that. We're going to keep doing more of that. But let's see. Second up, we've got some COVID-specific webinars. So 58% of people are saying, "Hey, I need more webinars, and I need them related to COVID and what's going on right now." Certainly keep that going, and we know other partners out in the world are doing this too. And not surprisingly, the next up is 47% of you are saying telehealth information, whether it's through, offered through video recordings, webinars, written things. So yes, I think we're definitely going to be seeing more and more of that come out. We've been seeing that, and we certainly, I think, through both National Council and Primary Care Development Corporation, we've seen more of that. 20% of you are saying some live group relaxation sessions, maybe like guided meditation, breathing exercises. I think that's a cool, so 20% of people are endorsing that. I think that's a cool one too. We're good friends of both National Council and PCDC, the Collaborative Family Healthcare Association. Just last week, I believe, had a sort of town hall kind of regional report out, and they started that off with a relaxation session led by Neftali Serrano. I thought that was great. So I think we can kind of use some of our kind of collective resources to offer things like that. A minority of people are saying town halls and listening sessions. So it sounds like people are asking for information. That is helpful, and that's what we're getting from you today. That's really important to know. 29% of people saying readings or resources related to COVID. Closely followed by 22% saying on other topics too. So I think kind of more of what's going on is what people are asking for. And also 36%, a pretty good minority of people are saying abbreviated webinars, things like 20 or 30-minute quick talks. And I think that gets to the point that people are busy. As we saw, a large number of people here are calling in from your clinics. And interestingly, to be honest with you, I was concerned that perhaps the world is a little bit overwhelmed with information, with offerings, with webinars. That's something we're always concerned about, is kind of like what we call like TA overload, or what's your capacity? And we're always thinking about that. And so only 4% of people are saying kind of I'm at my capacity, nothing else. And so, we'll find ways to make sure that you're getting the right dose. But also it sounds like we're going to need to keep putting more out here, and that's what we're going to do. And also a small number of people, 9%, saying financial assistance information. Again, and Chaim, you can take us to the next slide here, but yeah, we'll leave it there. And so the National Council just shared out today information on behavioral health specific sort of safety net finance packages. Primary Care Development Corporation will be sharing more information from our lending and investing, as well as coalitions we're part of, and primary care specific financial options. getting some suggestions, and maybe we have a meditation lunch hour. I think that's a cool idea. So, we'll keep sharing out. Other folks are still sharing information. Email is important, especially in the rural area. Great point. I'm always concerned. I'm like, gosh, are we sending out too many emails? But for some people, that may be one of the major sources of information. So thank you, everyone. I think we're at time, so I'm going to kind of wrap us up here. But and we'll make the recording available to you. We're going to continue with life as it's been scheduled for our diabetes series. So this is kind of our one-off thing, but so we'll continue with that. You have my information, Bree's information, and certainly the information of PCDC and the National Council. Bree, any other kind of parting comments, folks?
No, thank you all for your time and attention today and for all the great contribution in the chat. And we'll certainly be taking note and thinking about our path forward. So I appreciate your time.
Yeah. Thanks, Bree. And again, the message to everyone, you're not alone in this, whether you're out, in Kalamazoo and, or somewhere in Wyoming, or you're here in New York City, kind of at our epicenter here, if you're out in DC, if you're in California, wherever you may be, you have a community here, and everyone's in some form or fashion going through this. And again, I love that point that not everyone's a superhero, even though they're acting like it. And I think we can all use the support. So thank you again, everyone. And we will see you later this month in our upcoming offerings. So be well.